Did you know that modern fertility science can now look into the future of your child before they're even born? No, this isn't science fiction. We're talking about IVF. You probably know it as the process that helps people get pregnant. But here's what most people don't realize. IVF can also detect genetic imbalances, prevent devastating hereditary diseases, and even give us clues about a child's future health, all before the embryo is placed in the womb. So what exactly can IVF reveal, and how close are we to customizing our children's genetics? Let's dig into the secret power of IVF you were never told about. So before we dive in, just to let you know that we're seeing that 55% of our viewers who watch our channel regularly have not subscribed to us yet, so we're asking you a favor. Before we start our deep dive, if you like us and want to support us, there's a free and simple way to do that. Just hit that subscribe button so that you never miss out when we put out new videos. We assure you that we will commit to bringing you the best videos each week. We also crave your feedback and suggestions as we aim to give you the best content possible. First, let's get the basics straight. IVF, or in vitro fertilization, literally means fertilization in glass. Here's what happens. A woman's eggs are extracted from her ovaries. They're fertilized by sperm in a lab. The resulting embryos are monitored for a few days. Then, usually just one embryo is transferred into the uterus. Simple in concept, but it's actually one of the most advanced medical procedures in reproductive science. It's helped over 8 million babies come into the world since the first successful IVF birth in 1978. But the most mind-blowing part isn't what happens after the embryo is implanted. It's what happens before. You see, IVF opens a brief window, a unique chance to look inside the embryo's DNA before pregnancy begins. This is where Preimplantation Genetic Testing, or PGT, comes in. There are two main types: PGT-A tests for an abnormal number of chromosomes. PGT-M looks for specific hereditary diseases like cystic fibrosis or Tay-Sachs. How does it work? On day 5 or 6 after fertilization, the embryo has reached the blastocyst stage, about 100 to 150 cells. Doctors carefully remove just a few cells from the embryo's outer layer, the part that would become the placenta. These cells are then scanned for extra or missing chromosomes, structural DNA abnormalities, specific gene mutations, and all this is done without harming the embryo itself. The result? A deep early view of an embryo's genetic health before it's even implanted. So, what can doctors actually find out? Plenty. Here's just a snapshot. Chromosomal disorders like Down syndrome, trisomy 21, Turner syndrome, missing X chromosome, or Klinefelter syndrome, XXY. Single gene diseases. These include cystic fibrosis, Huntington's disease, sickle cell anemia, and muscular dystrophy. Sex-linked conditions like hemophilia or Fragile X syndrome, which often affect male children. In other words, IVF combined with genetic screening isn't just about getting pregnant. It's about helping parents have a child with the best possible chance of a healthy life. Now here's where it gets controversial, and a little eerie. PGT was designed to screen for disease, but some researchers believe it could eventually be used to predict more than just health. Could we one day screen for intelligence, height, eye color, athletic ability? While scientists caution we're nowhere near designer babies, the potential is being hotly debated. Right now, companies are already advertising services that rank embryos based on polygenic risk scores, algorithms that use multiple genes to estimate likelihoods of future traits. For example, embryo A may have a lower risk of diabetes. Embryo B may be more prone to asthma. Parents can choose which embryo to implant based on these predictions. It's not sci-fi anymore, it's happening now. This isn't just theoretical. These technologies have already changed lives. In the UK, a family with a history of beta thalassemia, a severe blood disorder, used IVF with PGT to have a healthy child, free from the disease and a genetic match for their older son who needed a stem cell transplant. In the United States, a couple known to be carriers of Tay-Sachs disease used PGT to avoid passing on the deadly condition. And today, their daughter is completely free of it. For families with a history of devastating genetic diseases, PGT isn't just a tool, it's a lifeline. But with great power comes, you guessed it, ethical questions. If we can screen for disease, what about personality traits, intelligence, even things like potential mental health issues? Where's the line between preventing illness and playing God? Some worry this could lead to genetic inequality, where only the wealthy can afford healthier, better children. Others warn about the slippery slope of eugenics, a dark path we've walked before. And then there's the psychological side. What happens when a child grows up knowing they were chosen based on their genes? We're not just dealing with biology, we're tinkering with the very essence of human identity. So where is all this headed? As genetic sequencing gets faster and cheaper, we may soon be able to fully map an embryo's genome, predict dozens of potential health risks, and offer customized gene therapies before birth. Artificial intelligence could play a role too, analyzing thousands of genetic variants to help rank embryos based on health probability scores. And that's not all. New CRISPR technology could allow us to not just detect, but edit genes before birth, potentially erasing inherited diseases altogether. Of course, this raises even more questions. But one thing's for sure, IVF is no longer just about making life, it's about shaping it. So, the next time you hear about IVF, remember it's not just a fertility treatment, it's a genetic gateway, a powerful medical lens that can peer into the future of human life. From preventing inherited illness to possibly forecasting future traits, IVF is transforming how we think about reproduction, health, and even destiny. But as we move deeper into this genetic frontier, we must also ask ourselves, not just what we can do, but what we should. If you found this mind-blowing, hit that like button. Subscribe for more incredible Did You Know? Science mysteries, and drop a comment. Would you want to know your child's genetic risk before birth? Or is that going too far? This is the future of reproduction, and it's closer than you think.